congestive heart failure.
Hi, I'm Ron.
And my name's Grishella. Case history. JD is a 22-year-old male hotel receptionist who wants to enroll at Humber College in the hotel management program. He had a successful heart transplant in 2014. 5 months ago, he started feeling fatigue and dyspnea on exertion.
Here are some definitions that you can look over.
Impact of CHF in Canada. In 2005 to 2006, more than 54,000 people were hospitalized for CHF. Men were affected more by CHF than women, and the rate of hospitalization increased after the age of 65 years. The mortality rates for those under 65 were much lower. Those over 85 were 6 times more likely to die than those between the ages of 75 to 84. Global prevalence. About 5.1 million people in the United States have heart failure. 1 in 9 deaths in 2009 included heart failure as contributing cause. About half of people who develop heart failure die within 5 years of diagnosis. Heart failure costs the nation estimated $32 billion each year. Coronary artery disease, congenital heart defects, and cardiac arrhythmia are some of the causes of CHF.
Pathophysiology of CHF.
CHF is multifactorial and occurs due to multisystemic reasons, and so the heart and other organs will try to maintain cardiac output. However, these mechanisms often fail and aggravate the condition. This then leads to vasoconstriction of blood vessels and increased preload. So this adds to the heart's workload, which increases the heart rate, thus decreasing the ability of the heart to pump blood fully. The chambers of the heart tend to dilate and become hypertrophic. This decreases cardiac output and stroke volume and can cause backup congestion in the circulation behind the affected ventricle. If the left ventricle is affected, congestion in the lungs will be present, called pulmonary edema. If the right ventricle is affected, there will be a backup congestion in the right atrium. Blood will then back up and pull in systemic circulation. Systemic congestion leads to these symptoms. Since overall cardiac output is less and blood going to the kidneys is decreased, the kidneys then get agitated and release a cascading kinds of hormones which retain more sodium and water. ECG, echo, and stress tests are some of the tools used to diagnose CHF. Furthermore, here are some diagnostic tools that are performed to determine if CHF is present.
Here are some clinical features relating to CHF.
Here in the ICF model shows the affected structures a person might have with CHF.
Listed below are treatments for stage A pre-heart failure.
These are some of the options for stage B systolic left ventricle dysfunction.
Along with stage A treatment, additionally, here are treatments for stage C patients with symptomatic systolic heart failure.
Here listed are some treatments for patients with refractory end-stage heart failure.
Thanks for watching.
Created using Powtoon.